Ms. Capter? For what? For what purpose does the gentlewoman from California rise?
To address the House for 5 minutes.
Without objection, the gentlewoman from California, Ms. Lee, is recognized for 5 minutes.
Thank you, Mr. Speaker. As we stand now on the cusp of history, we have really never been this close to assuring quality, affordable health care for all Americans. While health care reform is essential for everyone, women are in particularly dire need for major changes to our health care system. Too many women are locked out of the health care system because they face discriminatory insurance practices and cannot afford the necessary care for themselves and for their children. In 40 states and in the District of Columbia, insurers are allowed to consider gender, mind you, when setting premium rates in the individual insurance market. This practice permits insurers to charge women more than men for the exact same coverage. Additionally, businesses with predominantly female workforces can end up paying significantly more for their coverage than predominantly male businesses. In the past 2 years, nearly 7 million Americans have lost their health care coverage. This is just not acceptable. While we all know that the current health care reform bill has some flaws, unfortunately it does not have a public option or an expansion of Medicare or a single-payer option. It offers vitally important advances for women's health. The bill makes health care coverage more affordable and extends to many health services that women need. Without health care reform, family premiums will continue to skyrocket, leaving more and more American women and families unable to afford health care. The health care system is failing American women. We owe it to each and every woman to pass this health care bill. When I cast my vote, I will be thinking of my mother, who nearly died giving birth to me, my mother Mildred. When I cast this vote, I will be thinking of my sister, Mildred, who suffers from multiple sclerosis. I will be thinking of all of the women denied coverage because domestic violence is considered a pre-existing condition by insurance companies. When I cast my vote, I will be thinking about so many of my friends who died prematurely because they did not have access to preventive health care. And, Mr. Speaker, when I cast my vote, I'm going to be thinking about my granddaughters, Jordan, Giselle Barber Lee, and Simone Lee, because when we cast this vote, are going to ensure that my granddaughters and my grandsons live longer and healthier lives. So if we do nothing, the health care system will continue to work better for insurance companies than it does for the American people. And that's why the President has put forward a plan that will give American families and small business owners more control over their own health care by giving them more consumer protections and shifting power away from the insurance companies. But if we pass health care insurance reform, we also will know that families and businesses will have control of their health care. The insurance industry will be prohibited, finally, from continuing its worst practices like denying coverage based on pre-existing conditions, and we also will cut the deficit by up to $1 trillion over the next 2 decades, $1 trillion. As the President said this past week, if not us, then who? If not now, then when? Now is the time. I urge my colleagues to support this health care reform legislation for our women, for our families, for our children, for all Americans. This is a major first step in setting a strong foundation where finally health care becomes a basic human right for all rather than a privilege for few, which it has been in the past. We are finally, mind you, finally catching up with the rest of the industrialized world.